All right. Thanks, everyone. Thank you so much. I'm really excited to be here. And I'm excited to be at the end of the day because we've spent so much time talking about these amazing advances in basic science, translational science, treatments. And I get to bring it all back to the experience of kids and adults who are living with this or taking care of those living with this. And my pitch for why we should pay attention to this talk is because none of the stuff that we did today is going to matter if we can't get it to patients and if we can't make their lives better. And so that's where I think this fits in really nicely with all the other work that we're doing. Disclosures, I do some consulting, but most important disclosure is that I couldn't have done any of this work without Dr. Anna Kerr, who's my collaborator, who's not here today. For all of the families that are out there watching this, this is a daunting task because I am trying to tell you what your lives are like and what your experiences are like and hope that I'm not wrong. So my goals are not to replace your expertise of what it's like to live with these disorders, but to validate your experiences for those of us in the room to help to share your stories, to learn from them, and then think about what are the big problems we have in this field and how do we think about next steps and how to get more and better care to patients that need it. So briefly, what we're going to talk about are the burdens of having these disorders for patients, caregivers, families, especially talking about challenges accessing expert care. I'm going to use a lens that's focused in the US, but from talking with folks internationally, I understand it's the same or even more challenging in other areas. We'll talk about the role of communication, especially information exchange, and how that might impact this and how it might give us something we can intervene upon. And then think about where we might go next and talk about some exciting ideas that I have about where we might take this work. And I'm reporting results, excuse me, from a study that used both interviews and surveys with families affected by complex vascular anomalies, including CLAs. And we focused both on adults with these disorders as well as parents and caregivers of children with these disorders. We recruited from multiple groups. We received funding from multiple groups, so we're very grateful for all of that. And you can see from this that in addition to CLAs, we had a wide representation of different phenotypes. And what's interesting, but probably not shocking to any of us, is that even patients that have very different presenting symptoms have a lot of the same issues with communication, with healthcare access, with understanding their disease. And so it was nice to pull all of these different patients together and understand what are the commonalities. When we first wanted to look at what are the burdens of disease, some of this work, when we go around the room, and if we asked all of you, you could probably tell me what you have experienced with your patients. We could probably pinpoint some of these things. Part of the issue was that before we started this work, nobody had ever documented any of this. And if you want to try to fix problems, you need to be able to identify and define what the problems are, measure those problems, and then be able to target what you're intervening with some logic behind it. And so part of this work is getting down on paper in a rigorous way what we all suspect so that we can know it and we can cite it and move forward. The four big issues that our patients experience that they expressed to us related to burdens of having their disorders were related to both the disease process, logistical, financial issues, social issues, and then psychological and emotional issues. And I also want to say one thing here is that I'm going to focus on some of the problems and some of the negative things. A lot of these patients have really good lives too, and there's a lot of positive things. We're not focusing on those today, but it's important to remember that there's good things about the lives and the happiness and the fulfillment that these patients have. With disease process, this is what we all think about when you have a vascular anomaly. It's the things we've been hearing about all day. Do you have leakage? Do you have bleeding? Do you have pain? With a lot of our young adults, there was concerns about sexuality, reproductive, both stigma and concerns like that, but also questions of, should I have a child? Can I have a child? Is it safe to have a child? Again, probably not surprising to many of us, but there were big logistical and financial burdens for these families, including how far they had to travel to try to get into a specialist, whether their insurance would let them get into the specialist, even if they identified them, the costs of that. Things like finding shoes if one side of your body is bigger than the other, finding pants that fit, finding the right braces. You find the company that will make you the perfect garment, and then you can't get it covered by insurance. And then the issues of absence from work, absence from school. Lots of parents who have lost their jobs because they're trying to take care of their child. Psychological and emotional concerns, or as we brought up yesterday, are really important. Both anxiety, depression, identity, sometimes even guilt, talking to some families where if they have a disorder that affects them less than it affects other people, they can almost feel guilt because they weren't affected as harshly as some other folks were. Some feelings of shame, some feelings of trauma. And this is a point that was made numerous times to me. And I think as clinicians, it's really important to hear this. In clinical language, it's a real compliment to be interesting. From the perspective of a person with a disorder, it's not necessarily a compliment to be interesting. And so one very notable young woman I interviewed said, she would always tell her doctors, I'm not interesting because of my leg, I'm interesting because of who I am. And so just little things like that, keeping in mind, ask if we're going to take photographs, explain why we're using them rather than saying you're so interesting because of that. And then social issues with exclusion, bullying, insecurity, stigma. And then also all of these in rare diseases in general, and especially in this area, uncertainty really fits in and exacerbates all of these. For example, with the social concerns and stigma, a lot of parents had anticipatory worry and anticipatory dread of what's going to happen when my child gets to grade school, when they get to high school. For people who are living with these disorders, I'm doing okay right now, but what's going to happen in 5 years and 10 years and 20 years? So uncertainty is a really important aspect of all of this. We did surveys too, and I'm going to simplify some of the results here, but our first analysis was looking at perceptions of mental health and physical health for these adults with these disorders. And we found some good things. So patients that reported that they had better quality of information about their disorder, they reported better mental health and better physical health. And all these are statistically significant and clinically meaningful findings. We also found, so maybe a little more worrisome, that adults with higher education also had better reports of mental health and physical health. And those who reported stigma had worse mental health and physical health. I'm going to start circling the communication aspects here because I think it's going to inform how we think about what we do next. And all of these burdens that we've been talking about are a lot harder to manage when you can't get to the doctors you need. So I'm just going to highlight a couple of quotes to kind of ground us in that patient experience. One patient told me, we had lots and lots and lots of problems finding doctors in our area that would basically even really be willing to work with my child. Another said we had to go across the country in order to get the care that we want with the doctors who we feel like really, really know what's going on. Then if you're trying to get a first-time appointment, it's months out. And I've also had people I'd interviewed who said, I traveled 1,000 miles to find out that I had a place 10 miles down the road that I never knew about that I could have gone to. So there's lots of those logistical issues. We also explicitly looked in our interviews and in our qualitative analysis, trying to identify what are the categories of factors that influence whether you're able to both access expert care and then maintain that care that you need. And we found 6 different characteristics: individual, clinical, scientific, healthcare, luck, privilege, and social. Individual characteristics is how strongly are you advocating for yourself? What's your personality? Are you okay being a squeaky wheel? You're probably more likely to get some of the care that you need. Clinical characteristics. Do you have a really obvious and apparent visible disorder, or is it more of an invisible disorder? That's going to influence the way, how aware people are of it, how likely you are to find that diagnosis. Scientific progress, we're moving it along, but there's still lots of unknown questions about diagnosis and treatment. Social networks, LGDA, shout out to them, helping all patients start to find the care that they need, but also getting misinformation when you go to certain social networks and social groups. The ones that were most concerning to me, though, are luck and privilege of, did you happen to bounce into the right doctor who knew or who saw the article or who knew the right doctor to refer to? Do you happen to live in the right town? Do you happen to live in a big city as opposed to a rural area that might not have the right access or expertise? And then healthcare systems of, I've had patients that are 5 miles away that their insurance tells them they have to go 300 miles away because that person's a network. And then information, again, the quality of information influences how all of these factors affect these patients and these families. So we wanted to dig more into, this is a separate project, wanted to dig more into what are the resources that we have around the country for vascular anomalies care. And so this was with Sally Cohen-Cutler, who's now out at CHOP. We wanted to map out where are all the children's hospitals, which of them have any information when you either look online or you make a phone call to say that they treat any vascular anomaly at all, And then of those, when we reached out, how many of them will respond and let us know that they have a vascular anomaly center? And I won't go into all the details of what different components they have, but just to give a 300,000 or 30, that's big, 30,000 foot view. This is, if you look at the database and map out all of the children's hospitals in the United States, here they all are. It's a heat map where each point marks at least one hospital, and the more green and red you see means that there's more hospitals there. So here's all the hospitals. Here's the ones that report that they have a multidisciplinary clinic. And here's all the places that don't have them. The other thing to note with this is not every multidisciplinary clinic is the same. Not everyone has all the same resources, and there's no standardization of what is considered multidisciplinary care. So to start with, even just at this basic level, I think we counted 13 states that don't have any reported multidisciplinary teams. And the other important point I want to make is families are advocating for themselves and for their kids very, very, very strongly. And it's not enough to rely on that for them to get the care that they need. So we looked at a validated measure of how easily you can access the care and navigate the healthcare system to get the care that you need. And again, we found that those who reported higher quality of information were more likely to have a higher ability to navigate the healthcare system. Those whose primary care doctors were more knowledgeable about vascular anomalies were more likely to get the care they needed. And regardless of your patient, of how well you're advocating for yourself, it did not associate at all with how well you're able to access care. So saying people are going to work hard, they're going to find their way to it. When there's structural issues, you have to find a way to get people around those structural issues. We can't rely on people to just advocate even more strongly. And so there's some worrisome things here. To get the care that you need, you have to constantly be able to advocate. You have to have financial resources, and you have to have luck. And that is a great recipe for disparity, because if you aren't lucky, if you aren't wealthy, and if you've got, say, 2 jobs or another sick relative or anything that gets in the way of being able to do a full-time advocacy job for yourself or for your child, it's going to be hard to get access to care. But there's some positive things that we're seeing as early signs that maybe if we can do something to help primary care doctors have more ready knowledge or access to tools to help them with these referrals, maybe that'll improve access. If we can improve communication or the availability of this knowledge for families, maybe that can help to improve this access. And so just to summarize everything we talked about today, there's 3 big problems I want to look at. One is poor communication, lack of information, and how do we address that? And I don't have answers, I just have ideas that we're moving forward with. So one is the Lymphatic Malformation Institute has just funded our idea to create this custom adapted plugin for Epic MyChart specific to complex lymphatic anomalies. The idea being that any place that has Epic can also encode this. And once we prove that it works for this disease, we should be able to do it for any disease. So we're moving forward with that. Hopefully in a year, we'll have a lot of answers. The other idea is, can we start leveraging new technologies like chatbots, like GPTs and large language models? Can we retrain those so that they are more specific to rare diseases? Nobody has done it yet. We're seeking funding, and hopefully we will be the first people to do that. And we'll report on that next year too. One of the other big issues is these barriers to accessing care. And this is where we have an idea for a program. We're again looking for funding, but is there a way that we can create this, nationwide collaborative network of vascular anomaly specialists that can be open and readily available for primary care doctors, for dermatologists, for hematologists, those who either have or don't have vascular anomalies expertise, to have a peer advisor, to get referrals to centers, to get actual consensus feedback and advice and thoughts, to get referral for external case reviews. So we're working on that. And again, we're gonna have a lot of results next year to talk about. And then we've got a grant right now that we're just about to launch that's looking at the role of primary care physicians in caring for patients with complex vascular anomalies. And both from the perspectives of primary care doctors and from the perspectives of specialists, because there's big silos where we haven't been able to communicate and understand what each other's perceived or desired roles or needs or abilities are. And I think there's a lot of room to improve that. And then lastly, one of the biggest challenges we haven't talked about a lot today is there are not a lot of adult providers, especially in hematology oncology. So it becomes a real challenge for adults to find the care that they need. Just like we talked about with all of the other data I presented, we can come up with a lot of solutions for the issues with why there aren't adult providers, but it's really nice when you can target a solution to the actual problem, and we don't know what the real reasons are fully. So we're looking for funding for this to try to understand, especially in adult hematology and oncology, what are the incentives, disincentives, motives for why there aren't a lot of providers. Is it because of RVUs? Is it because of lack of awareness? Is it because of time commitment? Is it something else? And then we would love to carry that work forward too. Also, if there's any exceptionally wealthy people out there that want to fund any of this, shoot me an email. And we got lots of other ideas. This is an exciting new field. We're looking forward to carrying this forward. And I want to thank everyone here, especially for any of the families who are on the call. I really want to thank you. None of the work, my work, or any of the work that we've been doing all day would be possible without you. And we are so appreciative. With that, I also want to thank my colleagues, thank my funders, and thank you all for attention at the end of the day.